Welcome to the Drilling Millions podcast, presented by Sage Dental Partners.
I find life is a string of pearls, and it's funny because I just saw a Netflix movie, and there was the same analogy. Life is a string of pearls, where each pearl leads to the next pearl, leads to the next pearl, and it kind of develops into something. And honestly, Third Molars Online started during COVID. I started teaching a little bit before COVID, just atraumatic extractions, because we don't learn how to take out teeth in school. And so many people came to me like, can I shadow you? Can you teach me how to, reflect a flap? I don't even know what it should look like. What instruments do you use? And then they would send me pictures of their extractions, or they would send me pictures or videos of them taking out a tooth. And it was just so messy. And I was like, man, there's no one teaching people how to take out teeth properly. And so that's why I started teaching, because I never really had that mentor to help me, and I had to learn the hard way and through failure. And so when I started teaching, that was always my philosophy, is like, I want to give back. This is my way of giving back to my profession, to help the people around me. I'm huge into service. And so whether that's service for other people or service for the people around me, my profession, this was my way. And so I started teaching and getting steam, and going to PDC, like Pacific Dental Conference, in 2020. And that was like the biggest lecture. There was like 500 people there. It was awesome. And then that was the same lecture that that was the same conference that was like, the igniter for COVID in Canada. So the media says, right? And everything shut down after that. It was like all this, steam I was gathering, I was, collecting, teaching is kind of just been wiped out, and like teaching doesn't exist anymore. And so I was kind of like bummed out, and then I couldn't go to work because we were on lockdown, and it was just such a frustrating time. But then I started getting people asking me, hey, can you do a webinar? And I'm like, what the heck is Zoom, right? And so we were all in that boat, and I started doing webinars. And then people were like, man, Nekky, I want you to run a course online and teach my like do these study clubs. And I was like, okay. And then it just kind of, the next pearl was, why don't I just create the most badass wisdom tooth course that exists? Because there's just nothing out there. You can watch as many YouTube videos as you want, but you need someone to explain it to you. And that was my philosophy, is to break down every single part of the procedure and really dive into it. And there's no models, there's none of that crap. Everything's clinical videos, the entire course. So I'll play a video of me taking out a tooth, and then I'll stop it and I'll be like, look at this here. This is what I need to do. And honestly, people just loved it. And I poured my heart and soul into it for a good year. And I'm surprised my girlfriend is still with me, because I totally neglected her. But I worked on this thing every single day for at least, 5 to 6 hours, especially when you come home from work. It was hard, and it turned into something awesome. And it was quite possibly one of my biggest accomplishments ever, is just creating something that can help so many people. And I'm super proud of it.
Did you do all the editing and videography yourself, or did you hire someone for that?
No, that was the cool part. It was like, man, I don't know how to do anything. So like I started watching YouTube videos like Final Cut Pro, like how do you edit a video, but like what kind of camera do you need? And how do you then I started getting into like quality of video, then sound design, and like what kind of mics do you need? And it just like, I don't know how many thousands of dollars I bought in equipment, like typical dentist, right? We always think that one piece of equipment is just going to make our lives easier, but it's not the equipment, it's how you use it, right? And so I spent so much money on I wish I could show you my closet full of lenses, and it would be like a photographer's dream. And it's all just sitting there because I didn't know how to use it properly. And so I had to learn everything myself. And I call my buddies and be like, hey, how do you do this? How do you do that? And then there was actually one of my buddies in my town. I used to coach him in basketball. So he's like, 15 years younger than me. And I was like, hey, can you help me with this website stuff? And so he totally helped me create my website. And now he's in med school at Queens, and he helped me out a ton. And without him, I wouldn't, like, he helped me like develop the vision, and it was really, really cool. And now I'm just having so much fun with it.
Wow. So for people that are just listening to this on audio, Nekky's video setup is probably the best video setup I've seen of any guest that's been on the podcast.
Thanks,
It looks
man.
like you're in like a professional, video studio. It's pretty nuts. So I'm assuming that's what you created for the
Totally.
Third Molars
Yeah.
Online.
Man, this is the best part, because like I remember coming home from work and I was like going on YouTube. There's no YouTube videos like how to create a studio, you know what I mean?
Yeah.
And then I'm like, how do these guys get the black behind them? And I'm like, they must paint their walls. So I came home with a big bucket of like matte paint, and I'm just like going nuts in this room. And I'm in my basement right now, and I have like, I don't know, this like satanic black room down here. And then and it's so dark. And then one of my buddies was just like, why didn't you just put up a black cloth? And I was like, oh yeah, I guess I could have. So when I go to sell this house, I'm gonna have to do something. I'll probably just have to tear out the drywall. Nothing's gonna cover this up, right? So
Yeah, exactly. Yeah, that's the classic, even for me, when I started the podcast, when I started the first podcast, Majestic Mutt, I was so obsessive over, I had a voice crack there, that needs to be edited out. Like the gate is not right there. I need to get a different microphone,
That's
and
right.
it's like, as I learned and as I progressed, I'm like, the equipment and the technique doesn't matter. It's the content. It's the content that actually matters.
Yeah.
There's this
Yeah.
filmmaker. You probably know him, Casey Neistat on YouTube.
Yeah, absolutely.
And his he used to just like have like 10 million views like an episode. He'd be filming this thing on like an iPhone 5, and he's just like, nobody gives a shit about the tech. It's all about the story.
Yeah, 100%.
So, I was just going to say, so I started implementing like that mentality, and since then I've just been focused on, I'm still using my like first microphone I ever bought. The background is not black, it's white. So just let it fly.
Dude, I'm with you, man. It's about like you said, it's the story. Everyone is searching for stories. That's the only thing in social media that will never change, is the personal connection, and it's the story. And frankly, if you dive into it, it's the authenticity of it. And that's why, exactly what you said, whether you're filming on an iPhone 5 or a whatever full frame DSLR camera here, it does not matter if that authenticity isn't there, because that's what keeps people around.
Exactly. So the way you delivered Third Molars Online was partly a result of COVID, but what's the traditional way that these sort of extraction courses are given? Is it in person? Is it, in a clinical setting? Do you learn this from a mentor? How is it given?
Yeah. So I used to just do like a 2-day lecture and kind of show you the stuff from like the videos from Third Molars Online. And it's cool because you can like, stop and you can talk about all the different scenarios. And then I would go into people's offices and we would hold basically like third molar extraction clinics, and they would bring patients, and they would freeze them up, and then we'd tell them where to section and how to section. And it all comes down to case selection, right? And knowing what to take on and what to refer out. And that's the biggest problem, is understanding and knowing what is going to give you an issue and what isn't. And until you get into trouble, you'll never know, right? And so that's kind of the learning curve I tried to implement. But the best sort of course, in my opinion, is you have to learn the basics. You have to, watch the videos. You have to try it a bit yourself first, take on easier cases, learn to reflect flaps, and then you go into a hands-on course where you start taking on more of those trickier cases with already some experience in your back pocket, like where to make incisions and stuff like that, because then your learning curve, what you've had problems with, and then now you have someone there to help you through it. But you don't know what you don't know, and until you have a little bit of experience, that hands-on course may not be perfect for you. But you kind of need all three. You need the background, you need the experience, and then you need the hands-on at the end. And I think that's what makes the best extraction course, and that's what I've been trying to do.
So there's a bit of a naive question, but so when you graduate from dental school, you do some extractions when you're in school, but when you graduate, are you essentially allowed to take on, this is a bit more of a broad question, but are you allowed to take on anything that you deem is within scope for yourself? Or is there, a guideline set out by some institution? How do you know what you can do and what you can refer?
This is the $1,000,000 question. And so let me frame it this way, because that is a phenomenal question. Short answer, yes, you can take on whatever you think you can take on. And that is quite possibly the most dangerous thing out there. Is you've been given this confidence in dental school that you know what you're doing. But then you get in the real world and you try to apply that, and you still have that mentality, especially your first couple, even your first year when you get out. And you will eventually realize how little you know when you're knee deep into a horrible extraction that someone with more experience could have taken out in 3 minutes, and you're on your third hour of trying to pick away at this tooth, and it's a horrible experience for the patient, horrible experience for you. But you need to almost have those experiences to fail, to understand where you need to grow from, and to realize I can't be doing this stuff on live patients because I just don't know enough yet. But dental school, that's what I think tricks a lot of people. Is it gives you this false sense of confidence, and until you get out there and you realize how little you know, with all due respect, I was there too, and you fail. Yeah, it's a very humbling experience for everyone, as I'm sure you may see for yourself. But yeah, short answer, you can, with your license, take on anything you want, and I think that's the dangerous part about it. As my new associates feel, and I have to cut them off from extractions and be like, okay, no more extractions, I'm going to see the extractions, you come watch me, and I'll help you get there, but you just have to take baby steps.
Yeah, that's the whatever that's saying, you know enough to be dangerous, and that seems like sort of the case, right? And the issue with dentistry is
Totally.
like, you don't know when you're in there, right? And sometimes it's like too late to turn back. You can't just be like, oh shit, I'm just gonna put this back in.
I know, right?
We'll suture you back
No.
up. Go to the oral surgeon.
Totally. And like perfect case in point. Before one of my associates started working with me, I'm like, hey, come watch me take out some eights. And he was like, yeah, he's all gunged up, and he was like ready to go. And he's just in there, and he's just like, oh, looks so easy. You just cut him in half and take him out, right? And I just look up at him and I'm like, I love you, man, but like, you can't replace my experience. Like, you can't think it's just easy, because it took me tens of thousands of teeth to get here. Do you know what I mean?
Yeah.
Don't substitute the appearance of ease with experience, because it took me years and years to be able to make it look that easy, because it really isn't. And that's why I have so much respect for the surgeons out there, or the other GPs that do a lot of surgery, or the other GPs that dive into biomimetic dentistry. And I look on Instagram and I see these phenomenal cases, and if I even tried to do one of those, it would be open margins everywhere. It looked like crap, right? And so I have so much respect for these clinicians that just dive into a subject like head first, and that's all they care about and read about, because they make it look easy when it really isn't. So yeah, it can be tough, especially for new grads.
Yeah. Have you heard of Dr. Bongard?
Absolutely, yes. Stephen Bongard in Ontario. Yeah.
Yeah, so we were just on Thursday night. I got to know him through a common friend, and so we were hosted, myself and a bunch of dental students at U of T. We all went down to his new CE center. It's called
Oh yeah,
Genesis,
yeah,
and
yeah.
this was the most insane setup I've ever seen. Like intraoral scanners, AI for prosto, you name it, he had the tech there. And one thing that I just found hilarious was he has a team of oral surgeons, he has a team of prosthodontists, he has a team of literally all the specialties in house. And he the way this building is set up is, on one end it's the clinic, and on the other end it's the learning center. And just top of the line equipment, sick golf simulator too, which I thought was sweet. But I was hearing him talk. He gave a little talk to us, and I couldn't help but just had to remind myself. I was like, Dr. Bongard's a GP. Like,
Yeah.
he's not a specialist, and he's doing more implant cases than probably like a lot of the perios and oral surgeons in the GTA as a
Yeah.
GP. So it's like, it goes to show, like, you don't necessarily need to be the prostho or the peri or the oral surgeon to do these cases, but you have to have, he has so much experience under his belt. You have to have the confidence in order to execute on those things, because if you don't, the results will speak for themselves.
Oh, absolutely. I believe in that statement to a point. I'm a GP and I'm proud to be a GP, but I also know how to what I know how to stay in my lane almost. You know what I mean? I'm not going to be taking on cases that are high risk, that are, horizontally impacted below the level of the second molar on an 80-year-old man. You know what I mean? Like, I know what I'm capable of doing and what I'm not. And I think that's what differentiates, a GP that will succeed, like Dr. Bongard, versus, or referring it to a specialist, because I think everyone has their role, and it's all upon us to determine what our role is and what is above our head and what is, we're able to do. And until you develop that that thought process and understanding your own skills, I think that's when you truly succeed, because taking on cases that are, above my head puts our patients at risk and puts myself in risk that I don't really want to get into. So it can be humbling, but it's just so important to learn the extent of your capabilities.
Yeah. Yeah. Like I feel a bifurcation almost, at least what I see in school. There's the group of people that are just way too ambitious and don't understand the extent of their knowledge. And then you have the other end of people that are just, I won't graduate until I do 5 GPRs, right? It's like, no, dude, like you can do this. Like don't worry about, messing up. Or it's like, I remember when I first started perioprobing, like the simplest thing in the world. It's like, oh crap. Like I'm like looking through it in my loops, and like the bleeding area looks like it's just like in my entire field of vision. I'm like, oh my God, this patient's bleeding out. Right. So it's like, there's like a bifurcation. So it's like, you're right, finding the in between of, I kind of hate to compare it to drinking and driving, but it's like, you got to be the one to self-regulate, because when you're left to make that decision, sometimes
yes.
it's a bit dangerous.
Totally. I know that's a rough analogy to make, but you're totally right though, man. Like it is self-regulation. You're in charge of what you do and what you don't, and that's where you can get into trouble. But can I tell you, the best thing that ever happened to me was my very first tooth that I took out. I remember cutting it in half, not knowing what I'm looking for, trying to section. It was an upper first molar, trying to section it, not knowing what I'm looking for. And it's just the easiest thing now, right? Not knowing where to make the sections. I know the vision in my head of where the section should be in the textbook. I make it through. I start pushing, boom, lose the tooth. Sinus. Push the tooth into the sinus, the mesial buccal root right in the sinus, the very first tooth I take out. This is how I start my career. But if that didn't happen, the overly ambitious dentist, like you just said, that was me, man. That overly ambitious dentist would have done so much more damage. We don't know what we don't know, and until like after that, I sought out every single person I could every single weekend. I don't care what kind of dental course it was, whether it was pediatrics or ortho or endo or surgery. I was gone. I was there because I did not want that to happen to me again. And we always, there's no such thing as failure if you learn from it. So that was a mistake that totally happened. And I think that was one of the best things that ever happened to me, because everything we do creates a reaction, right? A lot of times that's good, but sometimes it can go downhill. Don't go downhill fast. And I don't want any of my colleagues to get into that position, but we can create damage even with good intentions. Do you know what I mean?
Mm-hmm. Yeah, 100%. 100%. And you're right. If you don't have those experiences to really humble you, you can really let your ego. I'm not saying you had a big ego or disproportionately big compared to other, people in healthcare or dentistry, but you can really let that get away from you.
God, ego is the one thing in life that will tear you down. The second I was able to learn about ego and truly understand what ego means out there and how it reflects on yourself, that's the true destroyer of life, is ego. If you can push your ego aside and ask questions and truly learn, that's when you get true growth in life and in your career. So I don't know. If anyone ever comes to my lecture, if I'm privileged enough for anyone to come to one of my lectures, um, you'll learn quick. I don't share successes. I only share mistakes. I only share failures, because that's how we grow as a profession. And the problem I see right now is we're seeing too many pretty cases out there. We're seeing too many, these beautiful veneer, whatever, like beautiful cases, implant cases, and then you don't see the crap that goes on behind it. And there's a lot of crap out there, and we have to be able to feel confident and share our errors with others so we can all grow together.